Hey everybody, this is Kevin McFarland from The Art of Emergency Nursing, and you're listening to 30 Days to Being a Badass ER Nurse. In the next 30 days, I'm going to give you some quick tips and tricks to help you be a better ER nurse. And of course, as always, it's not just me you're going to hear from. I've recruited some of my friends to give you some of their tips and tricks so they can share their knowledge as well. So don't forget to subscribe so that you catch all the episodes. And if you find one of these tips and tricks are really helpful, give me a shout out on social media and share it with your friends. Let's get into today's tip. Welcome to day 9 of the 30-day challenge, 30 days to being a badass ER nurse. And as promised, on this weekend day, I have a pediatric tip for you. This pediatric tip comes from my friend Stephanie Filikoski, whose tip is that in the back of your mind, you should always keep in mind with any pediatric injury whether or not abuse is a factor. And it's kind of an icky thing to think about. We hate to think about abuse in children, but certainly it's always a possibility. So a couple things you need to do as a nurse is if there's any type of injury on a child, you want to get them as undressed as possible so that you can actually visualize and then document a complete skin assessment on them. Make sure there's no bruises, make sure there's nothing suspicious, no bruises, no bites, no lacerations, anything like that. You want to fully get them undressed so that you can actually evaluate all that. We hate to think about the fact that abuse is a possibility with our pediatric patients, but it always is, and it's something we need to be aware of. Oftentimes, if abuse is a factor, the person who is the abuser very well may be in the room with you when you're doing the evaluation. It's important to keep the right frame of mind and make sure that you don't start to treat the potential perpetrator different. You want to maintain as neutral of an attitude as possible. Try to be as calm and cool and collected because you never know the full story. You can think that it may have something to do with the person who's there, but you never know. So you definitely need to play it cool and document everything that you do and see on that child. These are cases that are very likely to end up going to court. So when you're documenting your pediatric assessment, make sure your documentation is something that you could read in court all by itself 5, 10, 15 years from now, and your note should be able to stand alone. So definitely keep an eye on that and keep an eye on your documentation. It's critical if there's pediatric patients and abuse is suspected. I want to take just a couple minutes and go over some of the physical clues that you may see if abuse is a factor. If you see lacerations, burns, bruising that don't have a good explanation, you definitely need to consider in the back of your mind abuse. Now, it's not the only thing, but it should be on that little shopping list that you have of possibilities for that patient. With burns, particularly, oftentimes if children get burned in abuse, they will have specific shapes. So it may look like a cigarette burn, it may look like a rope burn, or an immersion burn. All those things are possibilities that you want to look out for when you're dealing with an abuse situation. If they have bite marks without a good explanation, definitely consider the possibility of abuse. If they have any kind of trauma to their mouth, their face, any kind of oral trauma or facial trauma, without a good explanation, those need to be investigated and abuse needs to be ruled out. One of the things that physicians will often look at is they'll often look at their eyes and look for retinal hemorrhaging. If you see retinal hemorrhaging, you know that child very may have been strangled at some point. So you want to make sure to rule that out and document that that's either present or not. Any type of bruising, tearing, bleeding in the face or in the genital area definitely need to be investigated. When it comes to the caregivers, there's a few things that should raise red flags for you. Definitely if the explanation doesn't fit the injury or the pattern, then definitely keep abuse as a factor. that may be part of it. If the explanation keeps changing, if you ask multiple times and the explanation keeps changing, that's something that probably warrants further investigation. If the child is constantly blamed or as a cause for the repeated injuries, maybe something to look at. If they have repeated injuries, if they've been to the emergency department multiple times for little minor injuries, that may warrant further investigation. If there's anything that's blamed on a younger sibling, oftentimes this could be a distractor and something that you should consider for the possibility of abuse. Or if there's any kind of delay in seeking medical care. If they say, well, she hit her head yesterday, but we didn't bring her in, and now she's comatose, so we figured we better bring her in, that definitely is something that you want to consider. Now, keep in mind, these are some of the most complex cases we're ever going to have to deal with. So none of these signs and symptoms, none of these red flags are absolute. You have to evaluate it in context with the patient, what's going on, and with other professionals. So you're definitely going to get your docs involved, you're going to get your social workers involved, and potentially law enforcement. Now, remember, there's no harm in calling a CYFD or Children, Youth, and Families, whatever, to potentially investigate this person. It doesn't necessarily mean that they're automatically going to be taken away from the parents. It just means that a closer look is probably warranted. Never be afraid to do that. Never hesitate to do that. We hate to think about child abuse as a potential factor for our patients, but it's certainly something you want to keep in the back of your mind. I hope these tips help. Hope they help you identify if you see someone in question, and never apologize for wanting to investigate a little bit further if it's warranted. That's all I have for you today. Enjoy your weekend and have a great shift.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.